Low salt diet is extremely important. Why? Because sodium holds onto fluid. The more you're fluid overloaded, the more you're going to be symptomatic, get short of breath, and the more that you're going to put a strain and stress on your heart. It's extremely important that people understand that salt is one of the major causes for deterioration of heart failure. So it's a lifestyle change. It's not a 1 week or 2 week or 2 months, it's forever. And I think what patients for the most part don't understand is that there's a lot of salt in a lot of what we eat. And so the one very, very important thing is to understand you want to cut salt intake down to no more than 2 grams a day. You can start off by knowing that processed food accounts for 80% of the salt in the diet. So when you get anything processed, which means it's a can, it's a jar, it's a box, it's coming out of a plastic bag, you know that you're going to have high salt intake content, and you should check and see what it is. You can use water to rinse the beans, and 40% of the salt could be removed. If you go to a restaurant and you don't realize they're not going to go salt added, but if they use a word like soy or teriyaki or barbecue or brine or smoke, that's usually a signal, a sign, a clue you're getting a lot of salt. So that's very, very important that you're aware of these terms that are often used. One of the hardest things for patients is they start to realize they don't like the taste of the food when there's no salt. And I tell them, well then maybe you can mix it. Get something with no salt and then mix a little bit with something that does have salt in it. Start to slowly reduce it, and eventually your taste buds get adjusted and you won't miss the salt. But having a salt shaker on the table when you've got heart failure, big mistake. You want to avoid the things that are very salty. So to come back to these canned foods, look on the label. Patients know the magic number of 2 grams. You can look and see what you're getting and try to keep it under 2 grams, and then you're on a low salt diet. The average American is getting about 3,500 milligrams of salt a day, and often much more. We know that when you cut back to 2 grams of salt, even if you don't have heart failure, your blood pressure will come down.